Hello. I thought I could shock you with that loud hello. So my name is Jerry Sam. I'm an African, though a lot of people consider me a Ghanaian, but I do a lot of work across Africa, so I identify myself with the whole of Africa. I'm a trained journalist, but now I'm a turned civic tech person. So you can see there's a lot of identity issues there. I've been in the tech space for almost a decade now, and we've done very, interesting stuff. We showed a headline on corruption. We tried to visualize corruption using technology, so you can see what, for instance, $1 million represents using tech, so people can identify and get angry. We use technology to open parliaments. So we opened Parliament of Ghana, getting citizens to send direct messages to parliamentarians. So it was really fun. We got some of the parliamentarians who go to the community and make promises that they will pay school fees for their community members. They will take people to abroad and all of that. And we got citizens, we reminded citizens about it through text messages. And all of a sudden, they were getting flooded with messages that, yes, my school fees is up and all of that. That was fun, a bit naughty. And all this we're doing in the comfort of our office, air-conditioned. And then we're confronted with this. How do we send technology to this community? The community does not have electricity. Half of the community members do not know how to read and write. And all the past projects that we've done is all in English. You have to send text messages. You have to go online platforms, go and read about things that government wants to do for you. So how do we persevere? So this is actually perseverance for me. How do we surmount this challenge of getting community members in this community to access technology to improve health? So I'll come to more stories about this community. And then I wanted to share this with you as well. This is the state of health reporting systems in Ghana. So if I go to the hospital and I'm not happy with a particular service and I want to report, you see this suggestion box. Sometimes it's hidden because most of the time it's not suggestions, it's complaints. And who wants to hear your complaints all the time? So most of the time it's hidden. Majority of the time, nobody attends to it. And you don't even know how often they attend to it. And most of the time, you want feedback. This box will not give you feedback. So that's where we come in, to use all these technology platforms that we have something we call AproTech. So we're not reinventing the wheel, what is existing in the communities. And then we customize them so the community members can use it for good. And these are our key population that we're working with under this project. So we have excluded groups, and the community assured in the huts are part of the excluded groups. Then we have men sleeping with men. It's a taboo topic in Ghana and a lot of African countries as well. And then female sex workers. Then we have people living with HIV and AIDS, children under 5, pregnant and breastfeeding mothers, and the youth. So this is what we're using technology to reach out to these people. So we came up with a very fancy objective to reduce inequities, basically bring about fairness and justice in health delivery services through the promotion of good governance practices of accountability, transparency, equity, and participation. And the first step to do this was to establish an interactive digital-based platform. And in doing this, we built our fancy websites, as usual, but this time we engaged the community members to find out what works in each community. So that community I showed up there, you'd be surprised, they all have mobile phones. And you ask, what is the motivation for them to have mobile phones? Because they have family or relatives, some in abroad, some in the capital big cities, who send them mobile money. And you need the phone to go and receive or access the money. There's no electricity, but they have community charging centers. I wish I could show a picture of that. So you say generator, and it has a lot of plugins, and they all charge their phone. So they're always connected on the mobile phones. Some of the phones are feature phones, so it comes with social media, Facebook on it already. So we did not really reinvent the wheel, but used existing tools that they are comfortable with in using and adapted the project to fit that. And then we went out to mobilize our target groups and stakeholders to use the digital tools to share information about HIV and AIDS, give us feedback on those policies. The governments have policies on all those thematic areas. They monitor how the policy is being implemented, and then we do advocacy on maternal health and family planning. Malaria, wash is water and sanitation, which is really, really huge in Ghana. Nutrition and HIV service delivery. So in mobilizing target groups, the key thing that we do, our entry point, is to do sensitization. So the person cannot read or write, but they hear beeps on their phone. There's a teacher in the community, so most of the time you send the phone to the teacher to read it for you. The school kids who go to school can also read text messages, and they can give us feedback. So sometimes the messages come and you realize they say that, oh, tell them that when I went, they said there was no malaria, or they asked me to pay for malaria drugs, which is supposed to be free. Then you know that it's an elderly person or somebody who cannot read and write who will send a message to us. We also do radio programming to basically educate people, exercise them, and create awareness about policy directions on these thematic areas. And the radio program is a very good channel because it gets community members to actually phone in their own language and also to listen to programs from experts whom we assemble to participate in that. So I think I've spoken about some of the steps already, but our entry point really is to, basically you can only ask for something when you know about it. You can only demand your rights when you know your rights. So we try to simplify some of the policies. For instance, we have the National Health Insurance Scheme in Ghana. When you sign up to it, there are certain health services or healthcare delivery that is free. People don't know, and they go in and they get charged for it. But once you know and they tell you to pay for it, then you can question them and pay for it. So simple things like that. We use the same text messages to remind people to take their drugs, HIV patients to go to stations where they can get ARVs. We use the same text messages to basically tell people about things about sanitation. And then we get feedback. So it's interactive, it's two-way. We get feedback from the community members. And the feedback comes in various ways. It comes in SMS. Those who can go to the web can go and give us, fill a web platform. We do voice. Voice is very important for us. Initially, when we started, we were doing it in English. So it's interactive voice response, IVRs. And it will call your phone once you subscribe to it or once we harvested your number in the community onto the platform. And then when the call comes, you say, oh, for this service, press 1. For this, press 2. And it was all in English. So imagine if you can't speak English, then it basically is totally useless. So now we have to translate all those services into their indigenous languages so that they can access the platform and they can send us feedback. And then luckily, we have WhatsApp. It's a big savior for us. So people actually can do videos and send to us. They can do audios and send to us. They can take pictures. We had interesting ones of people collecting bribes, and pictures were being sent to us. So we are fighting corruption at the same time with this project. So the second step is what I just described. Citizens are able to submit their messages to us. And then we have the machine. So we've automated a lot of the way we compile and make sense or analyze the feedback. And the machine automates it. So messages that come that is talking to malaria goes into malaria. The one that talks to HIV goes to HIV. And once we do that, we generate a policy brief. And we send it to the appropriate quarters for action to be taken. Some of the policy briefs actually go into informing policy formulation and its implementation. So this is our framework. This is how we develop the platform. So here is the inputs. So inputs here is basically about all the information that we want the community members to know about. It gets processed. Some of them is processed into SMS. Some of them is sent into WhatsApp groups. Some of them is into documents. And it gets to the citizens. It gives them feedback. So the one that you saw up there with the community box, the suggestion box, is here. So they sit at the comfort of their homes and send it. But it's not all lovey-dovey easy like that. It's a bit of struggle. Because when you go to the communities, culturally, we like to see who we are complaining to. We want to talk face-to-face. We want to get our opinions across for somebody to act on it. So now we have to change the mindset that once you send a text message, somebody is also receiving it. So they get a feedback. We also have to encourage them to use the platforms because it saves time. And we educate them to let them know that a singular voice cannot bring about impact and change compared to a collective voice because your voice is all added up to what others are saying. So this is just the feedback processes. I mentioned earlier during our micro lab about verification. So yes, the platform is there. It provides anonymity. So for instance, people are able to complain without thinking that they're going to be victimized the next time they go and seek health service. Also, people living with HIV and AIDS, they are stigmatized a lot. So when they have their concerns, it's very difficult for them to go to the health facilities. This platform provides them the anonymity to send in their concerns. It also gives them the avenue and the channel to go to key health posts that they will not be stigmatized. And we're using it for education too. At the end of the day, the advocacy bit is the very important part for us. That of all these things that we do, what change does it bring about? And this is where it motivates us, it motivates the community members that their voice is included in policy making. Their voice is included in policy implementation. And for me, it's satisfaction to know that technology can actually bring about a change. There's no idea which is too small, but once you persevere, you'll be able to bring about a change. Thank you very much.